This is Kyle Cleveland with Temple University Japan's ICAST through the Institute of Contemporary Asian Studies. I have today with me Kathy Pike and Tia Powell from New York City. Dr. Kathy Pike is professor of psychology at Columbia University Irving Medical Center. She serves as chair of the faculty steering committee for the Global Mental Health Programs, director of the World Health Organization Collaborating Center for Capacity Building and Training in Global Mental Health at Columbia University, and Deputy Director of the Health and Aging Policy Fellows Program. She is also Senior Supervising Psychologist in the Center for Eating Disorders at CUIMC. Dr. Pike has been involved with global initiatives focused on mental health, education, and women's health throughout her career. She's held academic and administrative university appointments in Japan, where she served as Professor of Psychology and Associate Dean for Research at my university, Temple University, Japan, where I first knew Kathy, and a visiting professor at Keio. She serves as vice chair of the advisory board for the Johns Hopkins School of Advanced International Studies and is a trustee of the Jewish Board, the largest nonprofit mental health and social provider in New York State, and the International Rescue Committee. Dr. Tia Powell directs the Center for Bioethics and Masters in Bioethics at Montefiore Health and Albert Einstein College of Medicine. She holds the Shoshana Tuchtenberg Frackman Chair in Biomedical Ethics and is professor of epidemiology and psychiatry. Her bioethics scholarship focuses on dementia, public health policy and disaster response, end-of-life care, and bioethics education. She was formerly executive director of the New York State Task Force on Life and the Law, the State Bioethics Commission. She has worked with the National Academies of Medicine on many projects, served as the advisor to the CDC, the Health and Human Services, and its National Alzheimer's Project Act. She is a board-certified psychiatrist and fellow of the New York Academy of Medicine and American Psychiatric Association in the Hastings Center. So Dr. Powell and Dr. Pike, thanks for taking the time in New York City. I'm sure I'm catching you right before the beginning of yet another very, very busy day.
Thanks. It's a pleasure to be here.
Great to work with you.
I've been watching from Japan with equal parts fascination and kind of horror with what's happening in the United States and the response to the COVID. And you there being kind of in the center of the storm in New York City. How has this played out for you? Like, I'm sure if we would have had this conversation 2 months, 3 months ago, it might have been a somewhat different conversation. How is New York City doing right now?
Well, just jump in. And Kathy, I know you have thoughts too. Things are a little bit calmer, obviously. This past April was one of the worst months in terms of public health in a century for New York City, when the prior pandemic of 1918 was hitting the city also very hard. The toll on healthcare workers and other essential workers, public transport workers, all kinds of people, was just incredible. It was really frightening, and people were very brave and really put themselves in the line of fire to take care of people. I think there's real trauma for a lot of those young health professionals in particular who saw more death in a few weeks or a month than most clinicians will in a lifetime. So thinking about how to support that whole cadre of people over the next years and try and keep them doing their work and still feeling good about it, I think will be really challenging. Now it's much quieter. New Yorkers are, I think, as a rule, very concerned that we not go back to that we sort of keep safe, that we gradually open up and do that in a way that's responsible. So that's what I would say.
Mm-hmm. Yeah, and I think that's right. That's my experience of New York. There's a calm at the moment, but there is significant concern about ensuring that we don't return to the experience of the peak of the pandemic earlier. And it's unclear how much control we'll have over that as we go, although there are certainly things that we can do, and I imagine we'll talk about some of them today, that will make a significant difference in terms of managing the public health situation at multiple levels here in New York and globally.
Many people, I'm sure, are working from home, and that presents certain issues. You're both mental health professionals. What are some of the primary mental health impacts that you think people are experiencing from working at home?
Working from home is a there are many good things actually that are coming from working from home for people. As surveys and data start to emerge, there are a number of individuals and employees who describe greater autonomy, capacity to work more flexible hours, and enjoy the experience of being able to structure their day in ways that that work for them and their personal life that didn't work when they were commuting into work. The flip side is, of course, that working from home presents major stresses for many people. There is an intensification of role conflict for people. So whereas you used to do what you do at home, and you do what you do at work, that boundary is completely blurred now. And it's particularly difficult for people who have kids, young children who depend on them, young children who are home because kids are not in school, and older adults have parents with them. So that's fallen on young families in a very serious way. The burden has really hit hard. And that burden on young couples especially has been significant for women. So it's been a particular stress for women to be working from home right now as the data evolve.
Mm-hmm. And I assume that this is amplified with essential workers.
The essential workers, yeah. Well, the essential workers, right? So essential workers are, the stress there is that they can't work from home, right? So essential workers are being asked to show up and do their jobs in very complex and ever-changing contexts, and then return home. And one of the major stresses that essential workers report is their fear not only of contracting coronavirus, but of transmitting it to a loved one. And that's an enormous stress and a chronic stress that requires ongoing vigilance. And even when everyone does what they're supposed to do, the virus, there are many things about the virus we don't understand, and people are getting sick.
Just to support that, I think that's a really important point. Not only did frontline workers take risk themselves, but the burden of placing that risk on your family was enormous. There was a really moving television special about the frontline workers at my hospital at Montefiore. And the chair of critical care medicine got COVID and brought it home and gave it to her husband. And she was unbelievably moving in talking about how badly she felt that her choices and her work, which is incredibly important, also imposed risks on her family and her two adolescent sons. It was really profound for me. I knew the story already, but to hear her talk about it in that way was really compelling. So I think that's been an enormous burden for people who are showing up and doing that work.
Yeah, I think for many people, risk has been something of an abstraction. And now that they're starting to have family members or friends and people that they know as part of their social networks suffer from the disease, they're starting to change. And surely that's having an effect also on the partisan politics of it, of people who've denied even the reality of it. If they start having people that they know and love suffering from the disease, they start thinking a little differently about it.
Mm-hmm.
Well, we hope so.
Yeah, New York was at the beginning of the pandemic here in the United States. So there was not a lot of time for denial. And the recognition of the risk and the devastation was apparent right from the start here. But the United States is a big place. And in fact, it was very much an abstract risk in certain parts of the country. And unfortunately, when you look at psychology research, prevention is very hard to sustain when people don't understand and experience imminent risk associated with what they're trying to prevent. And we have seen the cost of that in spades at the moment. And the pandemic has really moved into other parts of the United States where there were virtually no cases just a few months ago.
This to me is part of the real tragedy in the US, that there was the opportunity to learn from the lessons of the Northeast, where the virus hit hard and very early, and to say, wow, that's really serious. We should think now here in Texas and Florida about what we want to do to protect our people. Unfortunately, this is a time where our society is very riven by political strife. And most tragically, the issues around the COVID, which is a non-political issue. The virus doesn't care if you're a Republican or a Democrat or apolitical. People somehow thought that what happened in New York or in New Jersey or in Boston didn't apply to them, and that they didn't need to pay attention to that, and that they could in some way be unaffected by the loss of life and the terror that went through those communities, and really missed an opportunity that was there for them to say, this thing is coming for you and it spreads like wildfire. Take care of your people. And now we have an enormous additional burden of illness that I think largely could have been prevented. And I think that's an enormous lost opportunity, enormous loss of life, and a waste based on foolish kind of political infighting. That's in part a man-made disaster that could, I think, have been prevented with appropriate public health measures.
It's being politically driven.
Yeah, unfortunately.
Yeah. But as professional psychiatrists and medical professionals, what's the psychiatry of denial involved? There must be a cognitive dissonance between seeing all of this tragedy around you and at the same time denying that it's even real. And the partisan politics of even wearing masks just seems so absurd to me. But how do you account for that? It's puzzling.
I think what's going on to some extent is that there are different stories that people want to write. And so people, depending on the agendas, there are always multiple agendas in a complex society like the United States. And there's an agenda, there's another complicated layer in the United States right now of intense political divide and an election that is just a few months away. Those layers have politicized something that, as Tia said, has nothing to do with politics. This virus is apolitical. So we are seeing layered manipulation of information and data to tell one story that does not map onto the public health data.
Just add on to that, I think that's true. I also think people psychologically have different ways of responding to a threat. So it could be like, you have a bad diagnosis. I'm so sorry, that little lump that you paid nothing to, we think that's cancer. So there's a whole range of responses to that. There are people who deny it, who say that's ridiculous, it's just a nothing, I don't want to hear what you have to say, I don't want treatment, I don't need that, I'll be fine. There are people who go completely to the opposite end, they become experts in that, they read everything, they find the best person, and they get on it, and most of us are somewhere in between there. So I think the politics that Kathy is correctly identifying layers on to people's ordinary fear and kind of irrational reactions to bad news, scary things. And this virus is really scary. Really, for anybody to take seriously, young people who were perfectly fine can die in, a day. More older people with other conditions are dying, but it can take anybody. That's really scary. And so there seem to be a fair number of people who are running from that information, who don't want to deal with it, whose response is, I'll just pretend it's not there. And so it's easy for them to be manipulated by somebody saying, yeah, no, it's nothing. It's not going to get you. It's not coming here. So it's part manipulating people based on our, attempts to hide from scary things.
Yeah, it's an interesting point. Kathy, your point about the stories that people tell at a personal level, that's a kind of, I suppose, psychological adjustment. But then there's also a larger political narrative that
Right.
lines with. And so I guess for a lot of people, the primary driver is concern about economic livelihood. And what do you see as the balance of the ethics of that between taking efforts to mitigate and reduce the transmission of COVID, but also acknowledging the need that people have to maintain an economic livelihood in the midst of this crisis?
So I'd say probably the primary public health message that people need to hear is that protecting public health and protecting the economy are not in conflict. You can't have one without the other.
Right.
If people don't have enough money to pay their rent, to feed themselves and their families, obviously you're not going to have good public health. So we do need to think about the economy. But you can't have the economy function if people don't feel safe, if your population is dying right and left. If your hospitals are overflowing, people are not going to be interested in going to the theater and to restaurants. So you really cannot sustain an intelligent response by pretending that these two things are in conflict. You have to do both together. So if you want businesses to open, you need to get that the ethical imperative is that you act in a responsible,
Right.
data-driven way. Find out the best public health information you can get. How could I keep people safe at my workplace? How can I keep the people who work there safe? And how can I keep the people who would be our customers safe? If you can't do that, your business will not be sustainable and you won't have public health. So we really have to stop pretending that everything's sort of one or the other. We really need collaboration and ways to think together about what's a sensible, incremental, gradual way of trying things and seeing if they work so you can go forward safely, and to think about how we'll restore our economy.
And, Kyle, it reminds me of 2011 in Japan.
Mm-hmm.
There's a natural disaster, and then there are layers of human response that make the natural disaster, that shape how things go for the population as in the wake of the natural disaster. And we have a very similar phenomenon right now. We have a natural public health crisis, and leadership matters. And the way that individuals who are in positions of authority and public service and leadership have a responsibility to their people. And we have a lot of leaders who have stepped up. We have people who have done extraordinary work. Borrowing from the Japanese term of the national living human treasure, right? Our own Anthony Fauci, Dr. Fauci has been a hero. And he's had a team of people who have worked with him, people at many, many levels who have really stepped up. But what is also true about something like this is that you need consensus. You need everyone to step up, right? You can't have lots of holes in the net and still catch the fish. And so we need everyone to be telling a shared story here, and that's not happening. And that's how we're winding up with very serious situations in different parts of the country.
My own research has been on the nuclear disaster in 2011, and a disaster at that scale tends to kind of amplify or reveal both the worst aspects of the culture and the best aspects. And so all those latent dysfunctionalities come out and become very, very vivid, and we're seeing that in the United States.
Recently, Kyle, I was speaking to a colleague in Nigeria who said to me, who expressed her condolences for what was happening in the United States, and then said, I just don't get you Americans. What is this thing with wearing a mask? And so, that kind of thing, right? It really brings out this idea, as you're saying, about the American psyche that is so identified with autonomy that it could cost the society many lives.
Yeah,
I think it's also true that the pandemic has revealed what is probably America's greatest failure, which for me is our health inequities, that minorities were significantly more at risk to die from the pandemic or to become ill with COVID. often people who have less education, less access to education, less healthcare, live in more crowded circumstances are exactly the people who can't work from home, do a variety of things to sort of keep themselves safe. So we really saw that America is a shamefully unequal society, and that we have not done enough. We have not done anywhere near enough, as we should have done, to make sure that there is adequate universal health care. So our failure to have a national health plan was really, it wasn't a secret, but what it actually means, I think, has been thrown into very stark relief by the pandemic, that it matters. Your zip code, your wealth matters a great deal in terms of how you survive the pandemic.
A lot of poor people, a lot of minorities, even if they don't work in so-called essential jobs, their jobs are essential to them. They have to go to work.
Yeah.
Mhm.
So as a result, they're disproportionately also put at risk on the front lines of this.
Yeah.
So,
Yeah.
well, what do you see as, Kathy, we're talking about how Governor Cuomo's dealt with this at the state level. It seems to be a disaster, despite the good efforts of Anthony Fauci. But at an institutional level, what do you see as the obligations of an organization or employer, not only to create a safe work environment, but to look after the mental health needs of their employees?
Yeah. Well, first of all, I'm not sure that people would say that Governor Cuomo's been a disaster. I think the jury's out on that. I think New York, has responded and actually is in a state now of steadily responding to the crisis in a way that we hope will ensure forward motion for New York. But to go back to the general question about leadership, I think this situation brings into high relief the critical role of leaders in public service and in industry and at the workplace. It is very clear that the way in which leadership responds to a situation of crisis has profound impact, not only on the process, but the outcome. And so we know, for example, that there are critical things that leaders can do at a time like this in terms of ensuring that they are communicating frequently and clearly, that they are making use of good data, that they are present for employees and creating opportunities for employees to provide feedback to them about where they are and what their special needs are at this time. Those things make an enormous difference in terms of managing in a crisis. And leaders have, and particularly in the workplace, laws are different in different parts of the world, but essentially, when you take on a leadership role in an employment context, you have a responsibility and duty to care for your employees. And so at this moment, stepping up as a leader is an essential requirement and a huge opportunity in terms of shaping how things will go for your employees.
And I'm going to encourage Kathy to talk a little bit more about something I've heard her speak about many times, which is to emphasize that mental health is part of health. It's an incredibly important part, and a part that particularly is under attack when people are so frightened about so many things about their keeping their job, their home, their kids safe. So, I mean, I would love, Kathy, to hear you say more about how do people, employers, how do they protect the mental health of the people who work with them?
Thanks. The reality is that right now, of course, we need to keep people set priorities around policies that protect people from contracting coronavirus. The other major issue, as you say, Tia, is that the mental health issues for people are paramount, and there are escalating concerns around a mental health crisis that could become part of and is an emerging part of a poorly managed crisis, right? So if you look in the popular press right now, you'll see headlines about will mental health be the next pandemic? And I actually think that it doesn't have to be, but if we don't prepare, if we don't put into place proper policies and procedures and practices that will support people's mental health at this very stressful, very difficult, very challenging time, we are going to see increases in terms of real mental health needs and mental illness. There's a concern around increasing rates of anxiety, depression. When people lose jobs, we see increased rates of substance use. We see increased risk for suicide. So managing all of these things, managing the virus effectively, managing the economic questions related to the public health issues is also intimately linked to ensuring the mental health of our population.
Yes, I think one of the conundrums is, how can you look after people's mental health if you're requiring them to go back to work? I don't know how compatible those two are, because I know in some universities, for instance, they're making, unless a person can demonstrate a pre-existing health condition, they're required legally to go back to work at the risk of losing their jobs. And that seems pretty contrary to like looking after people's mental health. That my university, our university has been very good about allowing people the choice about whether or not they'll be in person or teaching virtually. And probably 80 or 90% of the faculty have eventually chosen to do it virtually. And our university has been very supportive on that. But I know others at other universities who are being required to go back. How do you manage a person's mental health when, you know, you're essentially requiring them to put themselves at risk for their health and potentially for the lives of their loved ones?
So I'm going to comment a little bit on the mental health side, but Tia, I wonder about the ethical issues of that. On the mental health side, there are clearly things that leadership can do and that organizations can do to manage people's concerns and fears. You know, largely what people don't want to go back to work because they're afraid, and they do not want to contract coronavirus. Some also don't want to go back or are not able to go back because they have young children who are not in school and they have childcare issues. So there are complexities around this virus that need to be acknowledged, and so one of the primary recommendations for leaders is around flexibility, is around creating opportunities that allow for employees to flexibly engage in returning to work. That being said, there is also a need for leadership to effectively communicate how employees can engage in work and can be productively part of their workplace community. And much of that, doing that effectively, communicating effectively, will translate into increased levels of trust. Higher levels of trust are help reduce fear, enable employees to try and experiment with things and find solutions. People are incredibly resourceful and creative when there's a high level of trust and space to experiment and find solutions. So a lot of this, I think, comes from the top down around building a culture where there are clear communications of understanding that people are not just employees, but they are many things, including parents and partners, and have other personal realities of maybe comorbid health conditions to be concerned about, and bringing that true three-dimensional reality of the person to the workplace and saying that this is something that we can work with you on, coming up with a solution that works. Addressing the coronavirus has a lot to do with building culture that focuses on employee health and well-being, including mental health, which also is intimately linked to issues around diversity, equity, and inclusion. So, you know, this all moves together if you do it right.
Mm-hmm. What I see among some governors in the United States is they seem to be focused on the technical aspects of getting people back to work, without, for lack of a better word, with just a total lack of empathy for what.
Yeah,
Right.
I'd love to
Yeah.
underscore that point, Kyle. I think that's really important. A colleague of mine was telling me that at their academic institution, they were told, well, we're afraid that students, won't come back and pay tuition unless there's sort of real in-place teaching. And so we really need you to come back for that reason.
Right.
That's a profoundly insulting thing to say to somebody. Your health and potentially your survival doesn't matter to me. What I'm thinking about here is the bottom line, not about educational quality necessarily, but about getting in tuition dollars. There's no way that's sustainable for your institution. All our populations are aging. We have more and more older workers, and that's supremely true in academia, where the average wage of workers is, the average age of workers is much higher than in other kinds of fields. So I think people want to feel that their work has meaning and that they are valued for that work. And that's actually a particularly admirable aspect of Japanese culture, that people in all parts of the society take their work incredibly seriously and want to demonstrate professionalism. If you don't treat people with that respect, you will not have a sustainable entity. So I think what we really need to do is to work together with, just to stick with academic institutions, but it's really true at lots of other kinds of organizations, to say we all have a problem. We have a safety issue for students, for faculty, and we're trying to do something really important, which is to provide quality education. How can we do all of these things together without giving short shrift to any important part? If we're going to offer remote education, what real-time training can we offer to faculty to make it better? Because there are things that you can do to make sort of remote education better or worse. To do a lecture that way and drone on, that may not be effective anymore. Maybe you need to get people to really think about how can we be creative to make sure that the student has the experience they want to move forward, but to make sure also that you are respecting the dignity and the health of the people who work with you. Unless we can do this in a collaborative fashion, we're not going to have good outcomes. So, I think respecting the people who make your academic institution a high quality institution, you have to start there. And you have to educate students too, saying, I know it would be much more fun as a college student to be there in person and to be able to do singing groups and all of the things that make it fun. You are unlucky. We can't do that right now. That's not safe for you. It's not safe for anybody. So let us think about what else we can do, how we can make your education and your coming adulthood go forth smoothly as best we can under circumstances that are really difficult for all of us.
Both of you, I guess, have been consultants for organizations or leaders who are trying to make these decisions. And what kind of advice are you giving them? What's the nature of the conversations you've had with people who are seeking your advice?
Yeah, thanks, Kyle. I wanted to speak to that because I think I am really observing enormous differences that accrue, or enormous benefits that accrue when leadership gets in front of this and is focused in a thoughtful way around how do we move this complex set of priorities forward, and recognizing that whatever the workplace priority is, it can only be delivered, as Tia was just saying, with the valued assets of the employees, and that we're in this together, and we can't, again, there's the false dichotomy of having trying to move forward a profit or educational enrollment numbers against keeping your employees safe or your faculty safe or your students safe. That's a dichotomy that we'll never solve, right? Or it's a false dichotomy, I think we should simply say. But those who are stepping up are making a huge difference. I have recently worked with AXA Asia, which is based in Hong Kong, led by Gordon Watson. Actually, Gordon Watson and his family had spent many years in Japan, And they are now in Hong Kong. He's leading a very, very impressive effort around prioritizing mental health and prioritizing health and mental health within their health portfolio to ensure that they address the significant impact of coronavirus on their employees and on their related companies and clients. I can't say it frequently enough. I think the role of leadership at this time is really transformative. And when leaders step forward and put themselves forward around their own human experience of this, when they communicate clearly and effectively, when they respect that their employees have complex needs that have a place to be heard, and when there's opportunity for that kind of two-way conversation, when there are programs put in place that protect employee mental health, that promote employee mental health, and that provide access to appropriate care, we see better outcomes. So these 3 Ps of protecting, promoting, and providing access and information and appropriate services related to mental health make an enormous difference in terms of overall outcomes.
And I think they promote trust. I think when employees of an institution, whether they're university professors or people serving up hamburgers, if they don't believe that they are being dealt with honestly and treated with respect, you will not have a successful institution, just that simply. The people there need to be engaged in their work. They need to feel that they matter. They need to feel that their work is respected and that they are being dealt with honestly and given the support they need to do a good job. If you don't have that, you will lose everybody that has better options. And you will yourself gut your organization if you fail to treat people with respect and create a climate and environment where the people who work there say, look, it's tough for everybody, but you need to feel that you have trust. Trust is a very scarce resource, I think globally, but certainly in the US, there is great mistrust of government, of various kinds of authorities, doctors. So I think one of the steps we need to take to get back up on our feet is to think about how you deserve trust and what you can do apart from telling people you can trust me, which is the worst step to take. You need to demonstrate that you can be trusted. And I think that is really one of the lessons that Kathy's stressing about leadership. That's what a leader does. You show that you are trustworthy and make people feel like, okay, I will do this. I will be part of this organization.
I was just going to say, I wanted to share with people that we, in working with AXA Asia, developed a toolkit that is free and online for supporting employee mental health during COVID-19 and beyond. And in that toolkit, we describe critical steps that leaders can take to build trust, to create a culture where employees do feel that they're heard, speaking to Tia's point around trust, that depends on trust, and that they can engage in these efforts around addressing the coronavirus effectively. It also goes through, the toolkit also goes through what managers can do and how they can have difficult conversations with their employees around what needs to happen and what their health and mental health concerns are, and what to expect in terms of the mental health needs. So I want to offer that up and encourage people to just search for it online, and it's the supporting employee mental health during COVID-19 and beyond.
We'll link to that in the text that accompanies this podcast. I've seen in recent days that there's been some promise of a vaccine coming. Both Pfizer, there's billions of dollars being invested in this. Various countries have them at various phases. what are the ethics of, if we do get a vaccine, of implementing this? I heard an interview with Michael Osterholm from Minnesota, who you may know as a leading epidemiologist, and he said that even if the United States were to get 1 million doses of a vaccine, it would still take them a year to distribute it throughout the population. So, T, I know that you've done end-of-life analysis of the ethics involved with critical care, including, I presume, ventilators. And so for vaccine, how do you solve that equation? And what are the ethics of making that determination?
It's very complicated. How you might allocate vaccines is a little bit different than how you might allocate ventilators. But I'll say a couple of things about that. One, I have to point out, we're still waiting for the AIDS vaccine. And it's been 30 years despite announcements over the years that we're just like this far from getting it. So I hope we get one soon. I have no particular reason to think that that's the case. I hope I'm wrong. Two, again, we really need good data. Certainly, I think most people would support giving enhanced access to frontline healthcare workers. Fine, we need those people to be able to protect the rest of us. But I would expand crucial workers to other people, certainly public transportation employees, bus drivers, subway train operators, to be able to keep people able to move around the city. Although we should also encourage bike riding because it's good for your health, and that helps cities work also, but probably also primary school teachers. So I think there are different groups we need to think about in terms of needing protection. Our oldest old people are very vulnerable to the virus. The fatality rates for people who are over 85, even with a ventilator. So if you're over 85 and you get COVID and you have respiratory failure, even with a ventilator, the mortality rate is above 90%. So a ventilator for everybody is not actually the way to solve this. You really need public health measures. You need something like a vaccine, and if you can't get that, you need protective measures, masks for people who work in nursing homes, that kind of thing. It's also true that, so you might think, well, the oldest old are dying at high rates, maybe they need the vaccine. But there are data that suggest that very old people actually don't form a good antibody response, even with a vaccine. So that might not be the best group to give it to. Maybe you need to give it to the people who work taking care of the oldest old among us. So we need good data. We need to figure out who's at risk, and we need to figure out who will benefit from getting the vaccine, not just the person who receives it, but who they come in contact with will be benefited by that person getting the vaccine. And I think Mike Osterholm, absolutely a wonderfully thoughtful expert in this field, I think he's right. We will need rationing at the beginning when we are lucky enough to get a vaccine. And until we have one that we know works and is effective in lots of different kinds of people, we better double down on public health measures like protective equipment, social distancing, and promoting people who can work at home, doing so safely. So that's how I'd respond.
T, you've done work on the ethics of who is put on a ventilator, and I guess New York must have been on the leading edge of that. T, through your work as a medical ethicist, you've been involved with decision-making and consultation on who is put on a ventilator, and I presume that New York was on the leading edge of that in the first phase of this pandemic. Can you speak a little bit more about the ethics of that?
Sure. I would say New York both was and was not at the leading edge. New York, like a number of states, had plans in place for rationing ventilators should a public health disaster just like this ever emerge. New York never implemented those guidelines. So for good or ill, I actually think, in fact, we didn't need to ration ventilators to a first approximation. I think there are some hospitals that were overwhelmed, and we could have benefited at that time, not necessarily from more ventilators, but from a better central way of redistributing patients. We know that even at the worst of the pandemic, there were facilities that were not full. And if there had been a competent central authority looking at where are there beds, where are there too many sick people, where is there an imbalance, we probably would have been fine. So we never really rationed ventilators. We got an enormous increase both in people and ventilators and ICU beds. But I do think that kind of planning measure is really important, to have everybody agree, to have everybody know, to promote transparency. If we're in trouble, this is what we'll do. It won't be based on race. It won't be based on income. It will be based on who can benefit and how we get the services to you. So to have guidelines that are fair and publicly known and dealt with evenly across an affected area, that I think is a real ethical priority, and it's clinically superior. It makes people know what to do. You can train everybody, you can get everybody set and ready to do it. So both, there's no conflict between what's ethically right and what works clinically. Actually, the two go hand in hand. Again, it's as we're seeing before, this is a false dichotomy that doing the right thing is different than doing what works medically. If you have everybody know, and it's fair and it's right and it's even across systems, then you're in better shape.
And to follow on Tia's point, it occurs to me that when you have those public health guidelines in place, you have better clinical care. And because of the transparency, because there's trust that the guidelines are based on data that are informed, that for best clinical outcomes, best health outcomes for the population, those who are in the role of needing to deliver care are at greatly reduced risk for the mental health consequences of being in the center of the storm. And there are a few groups in terms of mental health risk that we are most concerned about. One is a group that has conditions, mental health conditions before the pandemic, right? So there are individuals who have significant mental health issues that could be exacerbated by various aspects of the pandemic. You have anxiety disorder, and now there's something that could kill you that you can't see, and other complex ways in which these pre-existing conditions can get triggered or exacerbated. But for the frontline workers, these are individuals who are putting their life at risk, and they are not confident that what they're doing is right, or they're faced with this moral injury, essentially, of not being able to deliver what they have been trained to do, not because of a man-made problem. And that is an enormous confluence of enormous risk that comes with this confluence of factors that increase mental health risk. So at Columbia, for example, we have had a young physician who was working in the throes of the pandemic on the front lines, who died by suicide close to 2 months ago now. Fortunately, we don't have a lot of case examples like this, and I hope that we are around the country taking good care of our healthcare workers. There have been many, many efforts to shore up supports for healthcare workers, but without the policies in place that Tia is describing, and with the risks that come with being on the front lines, we have a very serious increased mental health set of concerns to address.
I'm sure the legacy of that will be post-traumatic stress syndrome that will follow people for years. In terms of the definition of comorbidities, is mental health included in that equation? I mean, a more inclusive definition would include that, because of course that affects not only a person's ability to do the work, it affects their immune system, their quality of life. Is that kind of defined out of that frame?
It's a significant medical issue. People with severe mental illness were very much at risk during the pandemic. We had a lot of people who couldn't see their regular clinicians, so they didn't necessarily have access to their ongoing treatment, to their therapy, who were unable to get the medications that sustain them. So it was a very significant comorbidity, absolutely not some sort of trivial small thing. It was enormously important in terms of how people survived the pandemic.
This has had an impact upon people individually and also in their work roles, but what about in their families? What kind of advice would you give to parents for how to deal with the emotional health of their children in this situation?
You know, Kyle, it's really interesting. I've thought a lot about Japan and the great East Japan earthquake disaster in the context of the current disaster, particularly related to family, because we conducted a series of programs following the 2011 disaster in Japan. And the program was to support mental health needs of families and communities who had survived the Tohoku disaster. And one of the things that people who participated in our programs talked about as a major mental health stress were the different ideas that family members had about risk and about protection and about what was safe and what wasn't safe. It created enormous conflict in families, that some of whom wanted to return to their hometowns, some who didn't want to return, some who thought it was safe to eat certain foods, some who thought it was not safe to eat certain foods, and so on. The same thing is happening with the COVID. We are seeing within families someone who feels okay about going to work, is following certain protective practices, following the guidelines, and feels that that is safe. Someone else in the family who thinks that's terribly unsafe and reckless. And individuals within a family, some of whom have a mental health condition that contributes to how they feel about it. So this has put enormous stress on families. And again, going back to the core message that I think is part of the way forward is building leadership, voice of leadership that is trustworthy, where families feel like they know who they can trust, they have resources they can go to, they have strategies for tuning out the noise, and they can then bring some measure of planful calm to how they're going to manage their family life. In terms of talking to children, it's a really important question that you ask, because kids are not in school. Parents are trying to work with young school-age children, trying to explain to the children why they're not going to school, why they're not playing, they're engaged in their sports activities, and so on. This is going to depend, the message that you give will depend significantly on the age of your child and your particular child's interest and capacity. But the specific case about a family puts the parent in the leadership role. So same principles apply. Clear communication, empathy, openness, transparency, information that will help people make effective decisions, all developmentally appropriate. So what you tell a 5-year-old in terms of those dimensions will be different from a 10-year-old, from a 15-year-old, but the same principles will apply.
I agree with all of that. And I would say a good parent has to be a little bit like a good mental health provider. You have 2 ears and 1 mouth for a reason. And you need to listen to your kids. Figure out what is it that they're concerned about. You may have your own anxieties, but that may not be what your 3-year-old is worried about. Some little kids think this is the best thing ever. Their parents don't go off to work anymore. This is so much fun. You know, they're delighted. So you don't have to be comforting them if that's not their issue. For other little kids, it's terrible. They miss their friends at daycare. They had their best friends that they used to play with all the time. So thinking about what is the issue from that person's perspective? Where do you need to provide comfort? What measures that you're thinking of in terms of safety, do those, but actually Zoom calls for your 3-year-old with their friends from daycare, that may be the best measure for your 3-year-old in terms of maintaining their health and making them feel like they're still connected with their little buddies. We do that with older family members, but actually some kids are much more computer literate than we are, a lot of them, and they can benefit from that too. So I would say really think about, how can I get them to communicate to me? What are the sore points for them? And where do we need to go this? As well as communicating what's appropriate for them to know, and about why you need to wear a mask when you come out. They don't need to know because grandma could die if you don't, but you need some better version of, it's dangerous when we don't do this. So I think we're all going to learn a lot about how to do this well. And we need to share good information with other people who you think are doing a good job, talk to them, get their best practices. We need to pool information because this is a really new challenge for a lot of parents and families.
I really appreciate you spending time with me in the front of a very busy workday. Are there any final tips or advice you have about maintaining our mental health or making ethically sound choices as we move forward in this situation?
I think one of the important lessons is to remind people that self-care is not selfish, that maintaining your own sense of stability and your comfort and going on and taking seriously the need to make your efforts sustainable by taking care of yourself, making sure you're doing the things that you know make you work better, and trying to avoid the things that you already know are not helpful to you. I think it's not selfish. It's actually the best way to make sure you can keep doing the work you need to do in your home, in your private life, and sustaining your family, and also the work you need to do outside. So I would make a kind of a public service announcement on behalf of self-care. It's not selfish. It's actually the best thing you can do for everybody.
And by self-care, just very fundamental things like a good diet, exercise, sleep, spending time with loved ones. Yeah.
Well, careful there. We all, as adults, need to learn a little bit about what makes us steadier and what makes us less steady.
Right.
For some people, spending time with loved ones is an absolute fundamental source of support for them. You may have loved ones, you may have family members who are quite difficult for you to be around, and really it's hard for you to sustain that right now. And you should think honestly with yourself about how to manage that. If you have relatives who are using substances and that's been a struggle for you, it may be a time where you need to say, I love you, I support you, and this is a risk for us, and I'm gonna not engage with you right now while you're doing that. So it's a hard thing to say and to think about, but it's important, Kyle, to be honest with yourself about what makes you stronger and what things you know are self-destructive for you.
It's a boundary maintenance issue because, people need to practice information hygiene as well, because, family members who have a different notion of risk can either amplify it or really downplay it to the point where they don't acknowledge the genuine concerns and anxieties that people have about it.
All right. So on that, to amplify, I think I fully agree with Tia on the self-care as being a critical piece of managing during this time. I think it's important to keep in mind that as our human makeup, our human character, anxiety is really a signal. Anxiety is a signal that something's not quite right for us. And it's a very useful signal when we think about basic human behavior, animal behavior, and it tells us it's an alarm. And either we fight or we flee, right? It's a fight or flight response.
Mm-hmm.
But we can't if we spend a lot of time fighting right now, we are going to exhaust our emotional resources, and we can't flee. And so this is what moves us into a situation that we characterize as a chronic stress. And so people need to, in the self-care, understand and pay attention to their internal signals about where they are in terms of their anxiety, and recognize that the fight-flight response isn't going to work, and it's calling on us to do some other things to cope and to be resilient at a time of a prolonged stress. And that's a much higher order challenge. And that is where the self-care comes in, and where the information hygiene comes in, knowing how much information to take in, and how much, is enough. You don't need a lot of the noise. It becomes noise, and it just increases this signal of anxiety.
Right.
And anxiety doesn't need to convert into impaired functioning, right? If you pay attention to it. So use it as your friend to let you know that it's time for you to do something about managing the situation for your health. And that will include having the flexibility around decisions related to work and employment, as Tia was describing, around self-care, around engaging interpersonally to the extent that it is helping you manage the anxiety and the concerns that are part of this big picture that we have to learn to live with and cope with, and be resilient through for the foreseeable future.
Right. Tia, would you like to add to that, or?
No, I think Kathy said it very well. I think just that kind of managing anxiety, managing your expectations, and really trying to think carefully and honestly about the things that are healthy for you and the things that are less so. Unfortunately, the lockdowns have caused some increases in domestic violence. So that's something for us to think about. What can we do to keep ourselves and the people we love safe? And it may be that you need to get out of the house and go for a walk and kind of chill out. People need to think about, what can I do to sort of keep this sustainable and keep myself in the kind of shape that I can feel proud of, and in the kind of shape where I can do the right thing for myself and for the people around me.
Kyle, I have two more things to add. One is, this is a time to be generous. Everyone is stressed, and the data are very, very clear that we all feel better when we create enough capacity, enough emotional capacity to show some kindness, some generosity, some empathy to someone else. And so if you can keep in the front of your mind this idea that, and it comes back to having some empathy, right? But the idea that this is a moment to be generous. It will only pay dividends going forward. And the last thing I would say is that we all hope that we will, years from now, be telling the story about this pandemic, right? Everyone who has lived through it will have their story to tell. And so I encourage people to think about, what story do you want to tell? Right. What do you want to be the story that you tell? And that will help clarify decisions about how you manage today and how you help yourself create the space today that will be the story you'll tell in the future.
That's so moving. I just find that to be very powerful. Thank you so much. This has been really superb. You've been so eloquently spoken. You've been so insightful. I feel a little bit better than I did a couple of hours ago having talked with you. And I'll ruminate on these and reflect on it. So it's a real service, and I think you're doing important work. And I want to encourage you to take care of yourselves. And thank you so much for spending the time with us.
Thank you. Really a pleasure.
Thank you, Kyle.
Thanks,
Kyle.
Thanks, Tia. Thanks, Kathy. Okay. This is Temple University Japan's ICAST through the Institute of Contemporary Asian Studies. If you'd like more information and to see our previous archive of events, look to the ICAS website, and also we have an archive on YouTube with previous events. Thanks for joining us today.